This video demonstrates one sequence for donning or putting on and doffing or removing one combination of personal protective equipment, or PPE, suitable for evaluating a patient for Ebola Virus Disease in an ambulatory setting. The proper use of PPE is one of the most important aspects of infection prevention and control in a healthcare setting and can keep healthcare workers and patients safe from infection. There are multiple sequences for safely donning and doffing specific combinations of PPE. The proper sequence for safely donning and doffing in your setting depends on the circumstances of each situation, including the suspected infectious disease and patient status, clinical setting, specific PPE products chosen, and the space in which PPE is removed. PPE can introduce risk to healthcare workers without adequate training and demonstrated competencies. Healthcare facilities are responsible for developing donning and doffing protocols, drilling to ensure they provide the expected level of healthcare worker protection, and sustaining adequate staff training and competency. In this segment, you will see one sequence for donning or putting on PPE using two different types of face masks. Keep in mind, the order in which PPE is put on will affect the order in which it can be removed. The first thing you should do before entering the patient's room is remove all personal items, including jewelry and watches. Next, secure or tie your hair away from your face and out of the face mask area. Now, perform hand hygiene. Wash your hands thoroughly with soap and water, or clean your hands with alcohol-based hand rub if your hands are not visibly soiled. After you've finished those steps, you're ready to put on the first pair of gloves that go under the sleeves of the gown. Next, put on the fluid-resistant or impermeable gown. If the gown has thumb holes, be sure to insert each thumb into the thumb hole. Tie the gown securely in back with a simple bow. If the tie is long, avoid the tie dragging on the ground by bringing it around and tying it securely in the front. If the gown has cuffs without thumb holes, make sure the cuffs cover the gloves at the wrist. Now it is time to put on your surgical mask or droplet mask. Either provides adequate protection. Place the surgical mask snugly over your nose, mouth, and chin. Fit the flexible nose piece over the bridge of your nose. Secure the mask by placing the ear loops behind your ears and adjust to fit. Next, put on the disposable head covering. Position the head covering so that it fully covers your hair and ears. The next step is to put on the disposable face shield. Position the face shield so that it fully covers your face and forehead. Make sure the foam edge of the face shield overlaps with the top of the head cover so that no skin is exposed. Alternatively, you may wear goggles for eye protection instead of a face shield. Position the goggles over your eyes and secure them with a good fit. If you are using a droplet mask with an attached face shield, place the mask snugly over your nose, mouth, and chin. Fit the flexible nose piece over the bridge of your nose. Secure the mask and face shield by placing the ear loops behind your ears and adjust to fit. Next, put on the disposable head covering. Position the head covering so that it fully covers your hair and ears. Make sure your forehead is covered and no skin is exposed between the face shield and head covering. The last step is to put on your second pair of gloves. Pull the outer pair of gloves up over the cuff of the gown. Now you're ready to enter the patient's room. But a special word of caution: keep your hands away from your face and avoid unnecessary touching of objects or surfaces while in the patient's room and while wearing your PPE. If the patient develops vomiting or diarrhea, or a clinical condition that warrants invasive or aerosol-generating procedures at any time during the evaluation, follow your facility's processes and protocols for donning additional PPE prior to patient contact. In this segment, you will see one sequence for doffing or removing PPE using two different types of face masks. Keep in mind, inappropriate PPE removal can cause unintended self-contamination. Removal of PPE should be done near the exit of the patient's room and before leaving the room. A large capacity trash container must be available for disposable PPE, and a reprocessing receptacle must be available if goggles are used. Keep in mind that your gloves and the sleeves and front of your gown are contaminated. Decontaminate gloves with alcohol-based hand rub or a disinfectant wipe to begin the doffing process. Also, if your gloves become inadvertently contaminated at any time during the doffing process, decontaminate your gloves or hands with alcohol-based hand rub or a disinfectant wipe. If you have a buddy or observer, this person should wear gloves to assist by untying your gown. If you do not have a buddy or observer, untie your gown carefully. Next, grasp the shoulders of the gown and pull forward with a quick, firm tug, tearing away the ties. Roll the outside of the gown inward, folding the contaminated outer layer away from your body, being very careful to avoid any contact with the outer part of the gown. Remove the second or outer pair of gloves as you roll the gown off your arms. Roll the gloves into the gown to avoid contaminating your hands, and hold gown away from your body. Keep your hands on the clean or inner side of the gown at all times. Carefully discard the gown and the gloves in the trash container. After you've removed your gown and outer gloves, immediately clean your gloved hands with alcohol-based hand rub. Remember to avoid touching your clothing or any other objects. We will now demonstrate doffing using two different masks. The first is for a disposable face shield and surgical mask. Remove your disposable face shield by grasping the band from the back of the head. Keep in mind that the front of the face shield is contaminated. Handle the face shield only from the band. Discard in the trash container. If you are wearing goggles, remove without touching the front, which is contaminated, and place in the reprocessing receptacle. The next step is to remove your head covering by grasping it from the top of your head and pulling it off. Discard in the trash container. Next, remove your inner pair of gloves. Again, keep in mind that the outside of the gloves are contaminated. Grasp the outside of one glove near your wrist and peel away from your hand, turning the glove inside out. While holding the first glove in the opposite hand, slide an ungloved finger under the wrist of the remaining glove, peeling it off. Discard both gloves in the trash container, handling only the inside of the gloves. Perform hand hygiene. Wash your hands with soap and water, or clean your hands with alcohol-based hand rub if your hands are not visibly soiled. Remember to avoid touching your clothing or your face before performing hand hygiene. The next step is to remove your surgical mask. Again, keep in mind the front of the surgical mask is contaminated. Handle only the ear loops of the mask As you lift it away from your face, discard the used mask in the trash. We will now demonstrate doffing using a droplet mask with the attached face shield. Remove the head covering by grasping it from the top of your head and pulling it off. Discard in the trash container. Next, remove your inner pair of gloves. Keep in mind that the outside of the gloves are contaminated. Grasp the outside of one glove near your wrist and peel away from your hand, turning the glove inside out. While holding the first glove in the opposite hand, slide an ungloved finger under the wrist of the remaining glove, peeling it off. Discard both gloves in the trash container, handling only the inside of the gloves. Perform hand hygiene. Wash your hands with soap and water, or clean your hands with alcohol-based hand rub if your hands are not visibly soiled. Remember to avoid touching your clothing or your face before performing hand hygiene. Next, remove the droplet mask, face shield, by grasping the ear loops and lift it away from your face. Discard in the trash container. The last step is to perform hand hygiene. Wash your hands with soap and water or clean your hands with alcohol-based hand rub if your hands are not visibly soiled. Remember to avoid touching your clothing or your face before performing hand hygiene. Open the door and exit the patient room. Immediately clean your hands again with alcohol-based hand rub. Proper donning and doffing of PPE requires practice to do each step right every time. Take time to don and doff PPE slowly and deliberately to avoid mistakes. It is helpful to use a mirror or have an observer to make sure that you follow every step correctly. Thank you for watching this video created by the Minnesota Department of Health in collaboration with state partners. For more information, visit these websites.